Good afternoon, everybody. This is Dana Harganani, Chief Medical Officer from the Oregon Health Authority, here for our weekly webinar series for healthcare providers on COVID-19. I'm joined today by Dr. Tom Jean and Dr. Ariel Smith, and we will walk you through the agenda for today. We're going to start, as usual, with some of our EPI updates. We're going to walk through just a few slides about reopening Oregon and orient you some resources online. We do want to hone in on some information for immigrants and refugees as a really priority population for our COVID-19 response. Want to give you just a sense of some of the conversations that are happening within the Oregon State Legislature, who's convened their interim legislative days. We're going to also share with you some upcoming guidance updates so that you have that on your radar. And then we'll finalize today's session with some of your questions that we'll respond to that we've collected, and also alert you to our new session schedule starting next week. As a reminder, due to the way we have these particular sessions set up, we won't be able to respond to your questions real time, but we do really strongly encourage you to send your questions to us either on the chat box feature of today during the session or through our healthcare provider email that we should have highlighted for you at the end of this slide set. So getting us started on our EPI updates, these are our COVID-19 testing results as of yesterday, cumulative. We've had a total of 3,861 positive COVID tests or cases, I should say. A total of 148 deaths, unfortunately, and here you can see, well, now over 100,000 negative tests. And as you know, these test results do not reflect the full impact of COVID-19 in our state. So I will pass it on to Dr. Jean to walk us through a few more slides.
Thanks. So here's our testing results weekly summaries. We've been watching these with interest, and we're excited this week to see that or from last week's data, the most recent week, that our percent positivity for test results has declined quite a bit further to 1.6%. We still had about 16,000 tests last week, actually a slight decline from the week before. And if you look at the positive number last week, that dropped quite steeply from 400s to 255 cases. So we can answer this a little bit further in the questions at the end, but basically this is reflecting both decreasing numbers of people who are infected and having symptoms, and the greater testing that's going on. So positive and across the board. I shouldn't use the word positive, but good news across the board, I would say. Our epi curve, after a plateau in April, it looks like we're seeing a bit of a decline now in May, and that aligns with what I just said about decreasing cases last week, and also a gradual decline for a couple months now in hospitalized cases. So good picture here. Main takeaway, this is our same ED visits graph, is that ED volume is still quite below normal, but it's been creeping upward. And in terms of COVID visits, they are holding pretty steady at about 1% of all ED visits. Next slide. For 1% of all ED visits are for COVID-like illness. Risk factors, again, the main risk factors that we're seeing in our cases continue to be contact with a confirmed case, having underlying conditions, and congregate living. So I think we presented these race and ethnicity tables last week, but I wanted to point out a couple things. First of all, you may have noticed, or you may notice right now, that we've got in the race table here a high percentage in the other category, 28% of all cases. And we've looked into that, and that's really kind of an artifact of the way that we ask the questions. So the vast majority of those people who are identifying as other race here are Hispanic or Latino, and they're just not identifying as any other race. And then on the next slide, we have ethnicity. And again, Hispanics or Latinos have been particularly hard hit, although their case fatality rate is quite a bit below that for others. And I'd say that in terms of what we're doing for racial and ethnic groups and disadvantaged populations in general, we've been working hard to do weekly updates with our community partners calls, provide translations for all of our public-facing documents. And then Dana is going to talk a little bit more later about immigrants and refugees.
Great, more to come on that topic. That's very important here. In the meantime, we're talking about, again, our current hospitalizations for COVID-19. So these are the data as of yesterday. So a total of 47 COVID positive patients in our Oregon hospitals statewide, with, again, just about half of those in an ICU setting and a subset of those requiring mechanical ventilators or mechanical ventilation. The column on the left-hand side are those who are either suspected or confirmed, so that number is larger. If we look at the trends in our state over time, you can see here, this is the confirmed and suspected cases that have generally been declining since early April. And we will continue to watch these closely as reopening and potentially further transmission occurs throughout this next phase in Oregon. Here you can see the trend line for COVID positive patients. Again, maybe an ongoing slight decline or more of a plateau recently in terms of COVID positive hospitalized patients. We continue, fortunately, to have plenty of capacity in our hospitals to be able to care for further COVID-19 patients moving forward. So speaking of reopen, we just wanted to share a couple updates with you. There is a lot of information on our website, which we encourage you to take a look at to answer further questions. As you know, now most of our state has moved into phase 1 of reopening. Again, I've highlighted a couple of the parameters for being in phase 1 at a county level. That includes expansion of local gathering sizes, however, still requiring a focus on physical distancing, some reopening of restaurants and bars, and restarting of personal services. Again, this is just a subset, and I'd encourage you to visit Reopening Oregon tab here under our website. That will give you much more information. Here is another snapshot. If you see on the top here, I have the tab Reopening Oregon. That's the tab you'd see on our main web page about halfway down. And if you see where I have circled on the right-hand side, the yellow, if you open that plus sign, you get to this page. This is actually already out of date. As of today, I wanted to highlight that all but 2 counties have opened into phase 1. Washington County has submitted their phase 1 reopening application, which is now currently under review. So that's the change from the slide that you should take note of. Some additional resources that are new since we last presented to you are here. Again, this is on our main web page. You see at this top right yellow highlighted side of this slide. When you open our webpage, you'll see these 2 links. The reopening criteria we've talked about before. It largely talks about what the phase 1 criteria are and gives you some information on those at a state level. If you go to the right public health indicators dashboard, that's a brand new dashboard that got posted at the end of last week. And I just want to show you a little more detail about what you can find there. This is a Tableau site, so you can dig in a little deeper into some of the data that we have here. This is one of the criteria for reopening. This shows you hospital admission data. This is statewide, but one of the criteria we're looking at for local regions or counties is looking at whether there's been a decline over the last 14-day period in hospital admissions for COVID patients. So you can get a sense of what that looks like here looking at the statewide data. And again, this is newly posted. You can see this information and you can dive in deeper given that this is a Tableau interactive site. Another example of what you can find on this is here on the far right, on the same dashboard, you can go down to county level. And if you could see at the very bottom, I was able to capture the Oregon statewide I guess, criteria and checks here to give you some of those criteria for phase 1 and what we're going to be monitoring throughout phase 1. If you actually were able to move down further in this page, you'll see that these indicators are listed for every county. Again, you can dive into every county and look at all of the criteria we've had posted here with regards to reopening, and then again what we're going to be monitoring throughout reopening. So further information that you can play around with and take a look at now that we have this dashboard up and running. Oops, moving on, we're just going to highlight a little bit of information you might be interested in on COVID-19 through our Oregon State Legislature activities. On our normal schedule, our state legislature convenes interim legislative days. Those kicked off last week. Here, I wanted to help you hone in on the agenda for the House Interim Committee on Healthcare that convened last week. And all of their agenda items were related to COVID-19. You can see presentations from both the health agency as well as many other leaders and community partners around COVID-19 and what are some of the areas of focus and interest, as well as alongside public testimony. So I wanted to offer that to you. Here is the agenda topics. Again, some more focus work and information from our Department of Consumer Business and Services, or DCBS, related to telehealth services. So you might want to take a look at that, as well as some really important conversation around COVID-19 impacts on vulnerable populations and work that is underway. If you want to look at this particular agenda and materials, you can use the link here, including a live stream of the testimonies that were provided. You can also go to the same website, the OLIS website, to look at the upcoming agendas or watch the upcoming meetings that are happening this week. The House Interim Committee is meeting with regards to their Human Services Committee, Education and Revenue. Again, anticipate lots of focus on COVID-19. And next week, the Senate Interim Committees will also be meeting. So just want you to hone in, if you'd like, for further additional COVID-19 conversations happening in our state. On this topic, we wanted to just help you know about some information that is available for immigrants and refugees and others who support or provide care for these populations in our state. So this is a subset of questions or frequently asked questions from some online information. I wanted to give you an idea of what kind of information is there, both because I think the content will be helpful for providers statewide, but also will direct you on our website where you can find the entire FAQ and broader set of information in multiple languages. So some of the questions that come up on this resource include just basic information and where can you find out information for enrolling in the Oregon Health Plan, and then specifically about our COWM insurance benefits. These are emergency medical services, particularly for people who do not need to, as you apply for these, require to provide citizenship or Social Security information. And this is a very important resource, I think, for our state right now, recognizing the disparities we are seeing facing many populations in our state. Insurance coverage could be part of that in terms of seeking early care access, testing, et cetera. So a couple other questions: if I have COWM, OHP, or private insurance, what will it cost me to get a test or treatment? Again, this FAQ helps to highlight that there shouldn't be any costs associated. Here we outline the work that the governor did with payers to ensure that tests or hospitalizations from COVID-19 wouldn't require any out-of-pocket costs. So again, further information here I think is really important to spread. Another question states, I am an undocumented Oregon resident. Can I be tested for COVID-19 or seek medical treatment for COVID-19 and get coverage through COWM? And the answer is yes. Again, we really want to be sure that people know that they can get access to COWM and get services and care for free. Another question which we've spoken to on these webinars before is related to public charge. This is information the federal government uses to determine determine applications or consider applications for becoming a U.S. naturalized citizen. So the question is, if we get tested or treated for coronavirus, will this be considered a public charge to myself or my family as we seek U.S. citizenship? And the answer is no. If you are a legal permanent resident, such as if you have a green card and you're applying to become a U.S. naturalized citizen, the federal government has issued an alert on its website saying they will not consider testing, treatment, or preventive care like vaccines related to COVID-19 as part of public charge. This has been an area that has created significant concern among many people in Oregon, and I think this information is particularly important during COVID-19 so that people can feel more safe to receive and seek care related to COVID-19. A little bit more information I'd want to direct you to. We've shared, again, some of this before. There's lots of information on public charge and specific to COVID-19 that I'd encourage you to have access to for your patients or community members. A couple more FAQs that you'll find in the information I'm going to show you in just 1 second. Asked if ICE can be at medical facilities and will medical information be shared with ICE, and the answer is no. The Department of Homeland Security recognizes medical facilities as dedicated sensitive locations, and medical information is protected by HIPAA and not shareable. And next, I just wanted to highlight here related to SNAP benefits, not specific to immigrants or refugees, but also some information in this FAQ. And I just wanted to highlight, knowing that food access, particularly around some of the financial challenges, quarantine isolation occurring with COVID-19, that these type of benefits are really important, and there's been some expansion for what's possible, particularly online, for use with SNAP benefits. Again, more information in the FAQ that we have available online. So with that, if you go to our coronavirus webpage, again, partway down, you'll see a tab here that says Community Resources for specific groups. And the questions that I've just been highlighting for you can be found in a larger document under this tab highlighted in yellow, Agricultural Workers and Employers, and it takes you to similar resources available in multiple languages. So again, I encourage you to think about these resources, how they might support community members and or patients that you are working with to help further ensure access to critical resources that are needed during this COVID-19 response. Okay, we are going to move on to some clinical questions, and we're going to start with Dr. Smith to respond to questions that have come up about hydroxychloroquine. So Dr. Smith.
Yeah, so hydroxychloroquine has definitely been in the news recently, and I wanted to highlight an article that was just published by Mihra et al. In The Lancet a few days ago. This was a very large registry study over multiple countries. They had almost 100,000 patients who were PCR positive for COVID-19, and they separated them into different groups depending on what they were treated with. And as you can see on this slide, about 2,000 received chloroquine, 3,700 and some received chloroquine with the macrolide, 3,000 hydroxychloroquine, and about 6,000 hydroxychloroquine with the macrolide. They compared this group with 81,000 patients who were not treated with any of these drugs. This was not a randomized controlled study, so these were not patients who were randomized, and they took that into account with some special statistical analyses that we'll touch on briefly. But basically, they were just looking at who got drugs, who didn't. And if a patient did receive hydroxychloroquine or chloroquine, but they also received remdesivir or another antiviral, then they were also excluded. And all of these patients had an outcome. They were either hospital discharged or had passed away by April 21st. So what they found, so again, they used this propensity score matching, which is basically just to try to make this somewhat analogous to an RCT, even though they do recognize that the group that didn't get drugs may have been a little bit less sick, or there may have been some other issues there, but they tried to do this statistical analysis to try to get a good comparison. And they found a pretty significant increase in hospital mortality. So the control group had about a 9% mortality rate, but if you took hydroxychloroquine or chloroquine, that almost doubled your hospital mortality rate. So hydroxychloroquine alone was 18% mortality rate, went up to 24% almost if you added a macrolide to that, and a little bit lower, but still very high for the chloroquine group. And that analysis, they controlled all of those for multiple confounding factors such as obesity, diabetes, heart disease, all of those other things that could have affected mortality. And they found, they also did a separate analysis looking at the de novo risk of ventricular arrhythmia, and it was almost exactly the same numbers, very, very similar to this. So that the hydroxychloroquine and chloroquine had a very strong increase in de novo ventricular arrhythmias.
So in case people are wondering, I was just going to ask, so for example, the hydroxychloroquine group had about a double the rate of mortality, but the hazard ratio is only 1.335, and that's just because of the adjusting for confounding, right?
Yeah.
So that's why, that's what they're trying to do with the propensity matching.
Yeah, so
it's still very significant.
Yeah, yeah. And then on the last slide, this is basically just their summary statement. This study was actually initially conducted to see if there was evidence of benefit or no benefit, but the authors didn't find any evidence of benefit, and they weren't actually looking for evidence of harm, but found that there was a significant evidence of harm, and it appeared to be directly related to the ventricular arrhythmias that we know are side effects of hydroxychloroquine and chloroquine. So they, of course, want to have any further randomized controlled trials before they can reach any firm conclusions. But based on this very large, rather robust study, the World Health Organization has temporarily halted all of its clinical trials where they were looking at hydroxychloroquine, and there's been multiple statements issued. The FDA has previously issued a statement that hydroxychloroquine and chloroquine should only be given to patients as part of clinical trials, etc. It shouldn't. You should use it with caution in your patients if you're treating them for COVID-19.
I would like to answer some questions that came up last week. First one was, what should we tell asymptomatic patients requesting testing? So as a reminder, we generally are not recommending testing of asymptomatic patients. And the main exception would be people in high-risk congregate settings that have active cases. However, it is up to an individual provider's clinical judgment, and the patient and the provider both need to understand the limitations of testing. So in asymptomatic people, the test is very likely to be negative, and negative results really provide little useful information and certainly no protection going forward that you're not going to be infected right after you get the test, for example. So it's really just limited utility and concern for a false sense of security. We're not recommending it in general. Next question, when can we expect to see the impact of reopening on the number of cases? So that's a great question. We certainly don't know the answer. We think it's likely to be weeks before we'll see any significant increase in cases, just given the incubation period of the virus and the fact that people are practicing enhanced physical distancing and hygiene measures. So we absolutely do expect to see some increase in the coming weeks and months. We're hoping it's going to be fairly minimal, and that all of our contact tracing and testing efforts will help us to kind of stamp out any major increases. The next question was about our percentage of positive cases, which has been steadily going down. Is this due to increased testing? Is this due to a genuine decrease in prevalence? And as I had mentioned earlier, it's really due to both, we think. The percent positivity has been declining since the beginning of April, so that's probably almost 8 weeks now. And the total counts of positive cases has been declining since early May, even with the greatly expanded testing. So we think the percentage of positivity is reflecting both of those things. There was a question about the percentage of the population that is healthcare workers, and that's roughly 3% in Oregon. That may not include every, for example, some of the clinical support staff, like medical assistants, may not be included in that. But the best evidence, or the best info I could find, was about 3% in Oregon. Meanwhile, 18% of our cases that have informational healthcare worker status reported being healthcare workers. We know that healthcare workers are at higher risk, but we also know that they're being tested at a significantly higher rate than the public. So both of those factors would go into why they are making up a greater proportion of our cases that are being found. Last question, are the local labs only using tests with FDA emergency use authorization? In particular, some of the big health systems, LabCorp and Quest. So all the major labs, to our knowledge, in Oregon are using tests with EUA. They have, some of them have very large PCR machines, and all those platforms have EUA granted COVID-19 tests. And then Quest and LabCorp, which are out-of-state labs, kind of regional or national labs, they were among the earliest to have their own tests that they developed granted an EUA. So all these major systems and labs are using EUA granted tests. It's mostly the kind of point of care, the serology, and maybe the new antigen tests that we'd be concerned. Some providers are not using an EUA granted test.
Great. Thank you, as always, for your questions that you've been sending us. We wanted to just give you a highlight of some upcoming guidance updates. We are working closely with Oregon OHA currently to update our guidance on the use of personal protective equipment in resource-constrained settings. We do have guidance up. The CDC also has guidance on optimization of PPE strategies. But I will tell you that we know that they are quite hard to navigate, and further clarity will be useful. So anticipate that to be coming soon. On a related topic, we're looking at updates to our guidance on resuming and or continuing non-emergent and elective procedures, as that certainly relates to existing criteria for PPE. So those two will have some alignment made as they're both updated. We know we're focused on providing some updates to our guidance for entry into acute healthcare facilities. Right now, there's been very significant limits around visitation to hospitals, for example, and we are working to provide a little bit more flexibility in that guidance, although still keeping a strong focus around infection control. We also know there's additional guidance coming regarding reopening, including also more information about what phase 2 might look like across the state. We know for sure that the governor has indicated that no counties will move into phase 2 less than 3 weeks from moving into phase 1, but I anticipate there will be more information about what phase 2 looks like, as well as guidance related to reopening that is still to come. And then we, as always, anticipate updated testing guidance as we get further capacity and understanding of needs and focus areas with regards to testing. Always more information, but wanted to put on your radar what things we know are forthcoming here in the not too distant future. We hope you will join us this Thursday again for Project Echo. I just want to call out that this is actually the final session for part 1. OHSU has been hosting these sessions for several weeks. On Thursdays, we've been honored to be joining them to provide state updates. So this weekend will provide a little bit of time for our panelists to reflect on the last couple months with regards to COVID-19, what we've been learning, and thoughts we have carrying forward. And then just at the heels of this will be a part 2 Project Echo. So we want to make sure you're aware of our changing schedule starting in June, which is next week. We are moving to a once weekly set of webinars or informational sessions for healthcare providers. On the first and third Thursdays at noon, we will continue these sessions. So they'll move from Tuesdays to be only on Thursdays. We will host these at OHA on the first and third Thursdays. You'll still be able to see the session information, the slides and recordings up on our website as they're currently posted, have been posted up until now. So you can go there to look for links to join, as well as where we've posted slides and recordings from past webinars. On the second and fourth Thursdays will be the Project ECHO COVID sessions part 2. And all of these are scheduled through August at this time. So please don't plan to join us on Tuesdays any longer. We're going to move to once weekly sessions. We will continue to actively look for your questions and try to respond to them, and certainly adjust as time goes on this summer to what the needs are based on what's happening amidst the COVID pandemic and changes in policy and epidemiology as we move forward. So again, one last call to remind you, please don't tune in again next Tuesday. We're moving to Thursdays only, alternating here with OHA presenting at our informational sessions as of today, and then moving to part 2 of the Project ECHO. And with that, we are going to let you have back a half hour today. Thank you, as always, for the important work that you do. Please keep sending us your questions, and we will look forward to joining you this Thursday with Project ECHO and then Thursdays moving forward. Thank you, everybody.